It is 11:05. PinPoint Health Show is here. And there you go. You want to reach out, 416-870-6400. You have any health issues? Want to talk? Bring it on. That's why Dr. Lou is here. He's also, I should say, for social, because he's totally taken his social media prowess to a new level. He's got his phone set up with a tripod. He's filming the show.
The videos. People like them.
And you just had me turn off all the studio lights so I can't see anything.
Well, it's because
I may end up calling the police and I don't even know.
There was a glare. It's not there are massive windows here. We're fine. We should talk about sleep medicine. Why are you so tired?
Oh, dude, I'm dying. I got a herniated disc in my neck for 15 years now, is because I'm getting younger every day. I wake up every night after like 4 hours with hands are numb, neck burning. I need a pillow.
It's a really common thing with people. So it's interesting that you bring it up, that people who have those types of chronic neck issues, right? Those nerves in your neck go into your arms and your hands, and so at night the nocturnal paresthesia, like when you're sleeping, when your head's turned the wrong way or whatever, your hands will go numb. It's probably not just the herniation, right? Like it's a lot of herniations exist but aren't symptomatic. It's also probably a combination of tight muscles. You're a really active guy. You're doing more and more activity all the time. Having a good pillow is an important thing for sure. It still might not be the be all end all, right? Like a lot of it too is trying to change positions while sleeping. Like what's your usual sleep position?
Usually, I'm usually a back sleeper, sometime on the side, but I switch it up because
back's the worst,
wake up in pain, and it forces me to move around.
With sleeping on your back is you're probably in slight flexion, and that's going to put pressure on everything, right? So that's actually the worst thing that you can do for what you have going on. You should probably be sleeping on one of your sides. I would say sleep on your right side is better because it offloads the heart a little bit. Pillow in between your knees and hug a pillow. Try that. The problem is with the tossing and turning, right? It's easy to tell somebody, this is the way you should sleep. Most people will say, I can't fall asleep any way except the way that I sleep, right? I was having a lot of this similar. Do you remember a few years ago, I was getting that every night. I was waking up, my arms were fully numb, but I would sleep on my stomach. And I was like sleeping on my stomach, hugging a pillow, my head turned fully one way, right? And so I was able to do it for the first, 30 years of my life with no problems because, you're young. And then as you get older, it starts to have an effect. So I actually changed the way that I sleep. I now sleep on my right side the way I just described. I've eliminated those symptoms by managing that. It took me a long time because my whole life I slept on my stomach that way and I could not fall asleep, but I just forced myself every night, just to try it, even just try it for a little bit longer.
Right.
I find though, if you can hug the pillow, that provides sort of a comfort and makes it easier. Yeah, it's like a big teddy bear.
Yeah. Want me to come over, big guy? I got to try something because the burning, and it's so bad it wakes me up. I'm like, and the puppy. Puppy wakes me up too, but the burning's worse. Yeah, well, no, for sure. And that nocturnal paresthesia, it could be horrible, right? Because especially if you don't know what's going on, like, and it just starts happening, you're like, holy. And sometimes if you stay on it long enough, have you found that sometimes it'll go like back to normal right away, but sometimes if you've been on it long enough through the night, it'll take a long time. Like I remember there were mornings where like I'd be driving to work, I'm like, my hand's still numb. I know, for sure. Yeah, it's a crazy thing. Yep. Sleeping posture. I wonder, it's interesting. I wonder what we were like, how we were really designed to sleep. Right, because we sleep on these beds and pillows, and we didn't evolve that way. We didn't evolve with beds. We evolved by sleeping on the ground perfectly flat or whatever it is. Some soft ground cover or something, right? Who knows? Something. I don't know. I don't know what I've never looked into like the anthropology of how we should or should not sleep, but I think it's a more common problem than probably you realize. Right, like you're not alone in that. I mean, I've had it myself. I think the biggest thing, the point of it is if you have to change your sleep posture. That's the biggest thing. If you can get onto your side, make sure your spine's neutral, then it should start to eliminate a lot of those symptoms. Yeah. Because if it was just the disc herniation, you would have those symptoms constant. Mm-hmm. They wouldn't. Yeah, you have a little bit, I'm sure, because you do have that problem, but it's definitely worse at night, which means it's positional. Right, that's the thing. It's not right, because otherwise the symptoms would be consistent 24 hours out of the day. Well, my physical problems have taken off the first segment of the show, so feel free to reach out. It's 416-870-6400. Pinpoint Health Show just getting warmed up right here, Global News Radio. 1113 Pinpoint Health Show. Info at pinpointhealth.ca. You want to reach out and call us now, please. 416. Call now. Do it now.
Yes.
We're not desperate. We're just asking.
It's crazy how people always wait till
5 to 12.
It's more because I know people are listening and they have questions, and there's always that hesitation. Should I call? Should I not call? But the reality is, the sooner you call in the show, the more time we can spend on every case. Not like we have to do that last segment and through 30 people, and you're just giving quick, like, oh, it sounds like this, move on, right? So if you have a pain injury question, I think now is the time to call. That's why the show exists, to give you the information that you're looking for and sort of help get you in the right direction. How's the
update with the clinics?
Good. We will very soon be expanding into the Oakville and Markham area.
Kidding, eh? Look at you, man.
So we're just continuing to look for good places that want to be affiliated with Pinpoint Health, providing good care, and that's like my biggest thing when I look at this stuff. It's to make sure that we're going to, if we're not starting from net new and we're acquiring something, that it is that they're already doing a good job. Right. So. We really, again, the whole point of this is to create an accountable environment for people looking for this type of care, to get the biggest things. And we have lots of things coming, like the social media stuff, like following Dr. Lou on social, and even Pinpoint Health. The company that we're working with, we're also going to be launching a YouTube channel, Spotify channel. We're going to be working on a podcast after hours where we can have discussions with guests that are longer than the allotted time that we have here. So we're happy to hear what you want to hear about. If there's people you want interviewed, things you want to learn about more in depth, send me an email at info@pinpointhealth.ca or reach out to me on social. But all of it is designed really to give you the better information. And that's a very, very consistent thing that shows up in the research about healthcare, that once you can provide information to people, they start to do better.
416-870-6400, star 640 on cell. Jason, good morning.
Good morning, guys. How you doing?
Good, brother. What's up?
Okay, so I've always had bad knees my whole life, right?
Yep.
Now at the tender age of 41, I'm thinking about. I actually started doing some weights for my legs, and I was wondering if that's a good idea, or bad idea.
Started doing weights?
Yes, ma'am.
Like strengthening.
Straining, yeah.
Yeah, so it's never a bad idea to strengthen any area of your body, right? Most problems, chronic, long-lasting problems, especially if you're talking your whole life, right? Like when you're young, you don't have arthritis in your knees, so that's not the cause. The cause is probably functional. If it's functional, the only thing you can really do is strengthen it. In fact, what we're starting to see, even things with like knee osteoarthritis that's severe, you can get improvements if you do the right type of strengthening program. So, I think, 100%. Like in general, is what you're doing a good idea? Yes. Where I put like a little asterisk beside it is you need to sort of know what you're doing. That's the next thing, right? It's like, it's good to be doing that stuff, but you also, the problem with self-directed things is you might do the wrong thing and you might injure yourself. That's why I'm always a fan of working with a professional for these types of things, like a chiropractor, physiotherapist, someone who's knowledge in these functional issues and can provide you the direction on, at the very least, where you should be starting, right? Like, I think a lot of this stuff, if it's a low-level thing, you can probably progress it yourself, but at the very least, it might be worth you getting sort of assessed to see what are some things that maybe you do want to avoid? Because my assumption based on your phone call would be that you have a functional problem. So especially with knees, there's so many variables. Like when you look at someone, are their feet perfectly straight? Are they toed out a little bit? Are they toed in? And even if you have one of those three scenarios, what's causing it? Is the knee rotated? Is the hip rotated? Is it the ankle that's rotated? There's so many biomechanical variables that need to be considered that will start to tell you, okay, which way you should be doing something or things maybe you should avoid, because not everything is equivocal. That's the reality of it, and just treating it as, to just clump it all in together as strengthening is not going to be accurate. There are definitely specific things that you specifically should do to strengthen your knee that will, yes, very much help you. I don't know what those are because I haven't assessed you, but that's my general advice with these types of things is I always think it's a good idea to get active, to do more, to strengthen parts of your body that are weak, that are creating problems. The question becomes, what are those specific things? And that is where I think it should be under the direction of a professional.
I see. Because what I'm doing is I'm trying to increase 6 inches on my jumping by summertime.
Okay. Is there a reason for that?
Yeah, I want to be able to dunk a lot easier.
Okay. So now, do you play like high level? Like, is this just for recreational stuff, or is it?
Yeah, it's recreational.
Okay.
I'm 41 now, so I missed the boat.
So you missed the. Yeah. So I mean, that's good. One thing I always consider is like, and I'm not telling you not to do it, but I guess the one thing that I think is important to consider is the potential trauma that can happen with those types of things. Like, I'm a big fan of, again, looking at benefit and risk. Like, I think it's good to be active, but I think sometimes I see it a lot with like sort of in your, like you're sort of an example. I don't know enough about you, so I'll sort of use it as a segue to give an example. But the weekend warriors, right? And I see it a lot with like, say, a hockey player, right, who's in their 40s, and goes out and plays hockey, but they're giving it their all, like they're in the NHL, and it's like, yeah, but you got to consider that there's a risk of injury. Like, I think it's good to be involved, to keep active, to have competition, but you may want to just to increase 6 inches on a jump is not an insignificant feat. Like, that is significant. That's 6 inches more falling back to the ground, making sure that you're landing the right way. Now, I'm not telling you not to do it. I am saying that if that is a goal and you're going to achieve that, then even more so than before, I think it should be under the direction of a professional, because then at that point, it's not just about jumping. It's also the mechanics. Like, it's not just strength, it's mechanics, and it's mechanics with coming down, because, basketball is notorious for ACL and meniscus injuries because of that jumping, coming down, and rotating. So I think it's really important to consider that, right? And mitigate that risk as much as possible.
Okay. I guess I got to get in touch with you.
Yeah, give us a call, Jason. I appreciate the call. Thank you.
Thanks, Jason. 1-855-55 Lou. By the way, Jason, 1-855-55-DRLOU is the place to start. And for the remainder of this hour, feel free to call in, get some answers, just like Jason, smart guy. It's 416-870-6400, Pinpoint Health Show, Global News Radio. It is 11:23. And there you go. I saw a recent interview with David Lee Roth, and he's kind of... Remember this video back in 1983-84 when it came out? He's doing the splits.
No, I wasn't even born.
Yeah, thanks. Perfect.
I was born in 85, man.
He's not doing that anymore. Old Dave's kind of singing the tune, but kind of standing off stage. But there you go. It just goes to show how much, as our last caller said, trying to achieve another 6-inch jump at 41. Not impossible, but
yeah, it's not
impossible.
Nothing is impossible, right? It's just about... It's sort of a conversation that I consistently have with people where they want to do something. And you've heard me say before that sometimes you don't know the realm of future possibilities, right? And if you injure yourself bad enough, it might mean that you never even play basketball again at all in any capacity, right? So that's a lot of things that I try to encourage people to think about. It's like, well, what's the long-term goal here? If the long-term goal is I want to be able to play basketball for the rest of my life, then it might not be a bad idea that every time you're on that court, maybe you're giving it 80%. You're not trying for 150%, right? Because it's all about, yes, risk-benefit. Now, if you're it's a different story. Like, you're a 16-year-old kid, you have the potential to go to the show, like, and you want to give it 150% at that point. It might be worth the risk at that point. But and again, I think this is a personal choice. I'm not suggesting that people should do what I say. I just want to make sure that people sort of at the very least consider it.
416-870-6400, star 640 on your cell. And Yanni, hello. Good morning.
Hi.
Good
morning.
What's
Morning.
up?
I've been better.
Nobody calls this show if they're good.
Yeah, good call.
Everyone that comes to see me, I'm always like, how are you? They're like, I wouldn't be here if I was good.
You're like a mechanic.
Great.
My car's
Great.
not perfect.
Yeah.
That's why you're here.
Nobody's ever happy to talk or see me.
I need a hip replacement, and I was wondering if there's anything I can do, to avoid it. Or I'm 60, and if I get one now, will I need another one at 75?
Yeah, so I mean, those very types of specific questions are much easier if I assess you. Obviously, like it's very hard to say I don't know. Like I'd have to feel like move your hip around, feel the mechanics, look at some imaging to sort of appreciate how bad it is. So that's the answer to sort of question one. Do you need a hip replacement? I don't know over the phone. I'm assuming someone has told you that you need a hip replacement,
Yes. I got images, and I've been to doctors.
Yeah.
I thought I can't put my shoes or my socks on.
Yeah, right. So then, you're probably going down that path in terms of will you need one by 75? That's another hard question. So the reality about replaced joints is that I believe the statistic is about 75% of them have to be replaced within 15 years. So, I mean, that's an average. That means some are before and some are after. It's a mechanical part, so it's no different than like thinking of a car, right? Like it's, if someone says, oh, if I get new tires, how long should,
Right.
You could tell someone, 100,000 kilometers. It's how fast do you go through that 100,000 kilometers.
Where you're driving.
Yeah, exactly. And where are you driving? What are you doing? So I think if you manage it well, you can definitely delay it longer. It's when I think one of the issues that happens is, people often feel pretty good after these types of surgeries, and then they overdo it a little bit, right? And it goes back sort of to what we were just talking about, that at the moment you start to overdo it, well, it's a mechanical piece that you're just going to wear through again. And if you wore through your own body, which is far superior than anything mechanical, you'll wear through that stuff. Some of it is inherently functional because what led your previous joint to sort of break down is a mechanical issue that's still going to lead this to break down. So it's easier. Again, it's very hard to say. It's easier for me to say when I've assessed someone because I can sort of gauge, what's your part of this should be what are your plans in the future. I know one individual who got his hip replaced and, all of a sudden felt amazing and like was going to the gym and running and doing all these things.
Life.
And then within 5 years, the pain was worse than it had ever been. And they actually ended up getting an infection within it. And it was so hard to clear up and et cetera. So, I think a lot of it is about understanding what the reality of it is and what you want to do. The other important thing is doing the right stuff before and after the surgery, right? Making sure that you're as strong and as fit as possible prior to the surgery, having the surgery, and then working on rehabilitating to the same level of fitness after, which is a part that a lot of people miss. For whatever reason, a lot of people miss prehabilitation and rehab. It's incredible how many people miss rehab. Because a lot of people will also be sort of, in Ontario, you can be referred for physio for I think it's 12 sessions following an operation that's covered by OHIP. But the problem with publicly funded therapy, and I may piss off a lot of people about saying this, it's often not very good because there's not great payment for it, and so it's just quick and easy. I'm just telling the truth on what I've seen, and so a lot of the times it's just quick. Oh, here, put this ice pack on, put this heat pack, do a couple of this, but that's not what rehabilitation is, right? It's not what it is, and if you're not doing the right things after, that's another thing that sort of changes the prognosis. So, I don't know if I'm answering your question fully, but I think you can appreciate where I'm going.
Thank you. I'm really active. I'm a hunter, and I walk miles and miles.
Yeah. So, I don't think it's something that you can't get back to doing, but maybe it becomes about, again, understanding, right, and listening to your body. Your body tells you things, and people often just don't listen to it. Maybe, if you're a hunter and once upon a time you could walk, I don't know, 20 miles a day, maybe you cut it down to 15. That way you can save 25% of the wear and tear, so I think those things are important. That's why the interaction, the assessment is so important, because part of the assessment, the majority of the assessment, is talking with you to figure out what it is that you do in terms of your hobbies, all those things, and then talking about how you can maybe build a plan for the future.
Okay, so call your office.
Yes. Yeah.
Monday.
Yes, sir.
You bet.
Yep.
Thanks a lot.
Thanks,
No
Gianni.
problem.
Appreciate that. It is 1-855-55 Dr. Lou to reach out, by the way, and you want to get info at pinpointhealth.ca. But for the remainder of this hour, Lori, I see you there, and you as well. Feel free to call in. Got some time. 416-870-6400. Pinpoint Health Show. Global News Radio. 11:33 on Saturday morning. It's 416-870-6400. Get some answers. That's why the show exists for this particular hour. Lori, thank you for hanging on. Good morning.
Good morning.
Hi, Lori.
I went for a CAT scan recently. Now I have osteoporosis, but I have my results right here in front of me.
You went for a CAT scan or a DEXA scan for osteoporosis? Probably a DEXA scan.
With the dye and everything.
Okay.
Yeah.
All right.
Good one. Anyways, I have my results right here. I don't know what to do about all this pain. I'll read it to you. Degenerative changes of the lumbar spine, compression fracture of the superior plate of L3 with approximately 50% height loss centrally, no significant bony retropulsion. There is also superior and plate something node, SCHMOR.
Yeah, Schmorl's nodes, yep.
Yeah, at T12, which is similar compared to prior. And then also something about a lipoma, like a fatty thing, and
okay. So you don't have to read. You don't have to. You don't have to read the whole thing. So what's sort of the question?
Well, what can I do about the pain, and does the fracture heal? Because the doctor says when you get older, the fracture doesn't heal too well.
Yeah, so compression fractures are often due to, like, as age happens and there's weakness in the bones. It's sort of. I mean, we think fracture and we think of like grabbing a bone and breaking it in half. Right. What a compression fracture is exactly what it sounds like. It compresses, right? Yeah. So there's micro fractures within a different area of the bone, and then the bone gets smaller. Now that becomes significant because as that happens, that will put pressure on nerves and things like that. It's not really the fracture per se that is the problem. It's what that height loss does, and that material. I mean, think of a pop can. If I crush a pop can, what happens? It has to move out widthwise. It's got to go somewhere. Yeah, it's got to move out widthwise. And widthwise in the spine means it's going to be pushing on nerves and things that matter. Oh. So that's where the significance is. Now, a lot of the other things, the problem with imaging, and you know, anybody that's listening to the show right now, if they heard what you just read, it all sounds scary because everything like Schmorl's nodes, superior end blades, degenerative disc disease, a lot of that stuff doesn't actually matter. It's just findings and they're medical terms for telling us what's there. Some of the things that are there definitely matter. In terms of how you manage that again is a...
Yeah, if you have a lot of pain and that, what can you do?
Yeah, so
I have Tylenol extra strength, and then I take Ativan because I'm nervous all the time, and I don't know.
So that, I mean, like, you know, I've been doing this show for a long time, and we've talked about the management of chronic pain, and anybody that's listened for a long time knows that the answer is very, very complicated because it takes a lot of different things. And so the reality is the best way to sort of figure out a plan is for you to either see me or anybody, for that matter, who's a professional and an expert in this type of chronic pain scenario. And so they can guide you on all of the options that exist for dealing with that type of an issue. But is it something that I can tell you, like right now, a quick sentence off, you know, on the radio that will help you? No, because if it was that easy, you know, this wouldn't exist, right? It would just be simple. It's not simple. It's very, very hard. I was reading an interesting statistic yesterday from the economic, what journal was it? I can't even remember now. But the stat was from the UK, I believe. So pain, like non-cancer related pain, so just generalized pain, is like $100 billion industry. It's what it costs the system. Cancer costs the system like $120 billion. So it's not that. Do you know what I mean? Like, it's not that much less. The point is cancer's not easy, but neither is pain. That's the reason why it's so much, right? If it was simple, then we'd have quick answers to it. But I'm happy to see you. Lori, and
do you have a clinic in Toronto? Because I live right in Toronto.
Yeah, so I see patients in my main hub in Etobicoke at Etobicoke General Hospital.
Oh, wow.
Yeah.
I live in Etobicoke.
Perfect. Beautiful. So give us a call. And we'll help set.
What is your number there?
That's what John's here for.
I'm going to give it to you. Give it to you right now, Lori. We'll let you go. Here it is: 1-855-55 Dr. Lou, DRLOU. Again, Lori, 1-855-55 Dr. Lou. You can call that, or you can email info@pinpointhealth.ca. We'll carry on. Thank you, Lori. Richard, hang on. We'll get to your call as well, and you still have time. 416-870-6400. Pinpoint Health Show. Global News Radio. 11:42 here until just before noon, so you got some time, but don't waste it. 416-870-6400 is the way we roll, and you roll as well. You want to make your phone calls and get some questions answered. Richard, good morning.
Yes, good morning.
Morning.
Before I ask my question, I heard you say you're coming to Oakville. Can you say when and where?
I can't say where because of confidentiality agreements. When? Probably around March.
Nice.
Oh, okay, that's great. I'm a mid-50s guy, very, very active. 35 years ago, I had my spine fused for scoliosis. I'm sure you're familiar with that.
I actually have scoliosis as well.
Oh, okay. So
yep.
I had the steel Harrington rod put in
yep.
there.
So how significant?
Because I've been very active. Things are good. You know, I do a lot of yoga and stretching, but the doctor at the time said I would be subject to probably arthritis through the years, which I think I do have now. Anyway,
for sure.
A few times a year, whether I'm shoveling snow or golfing, I get the most excruciating pain right in those kind of like in the lower back and the hip. Those two dimple areas.
Yep.
And it's just like someone stuck a knife in there. And I'm going through that right now.
Sure.
Just wondering for that. Is what would you advise for that? I actually booked a massage today to see if they can get in there, and maybe it's just muscle spasm or whatnot. But
yep.
Is that something you would just recommend off the bat?
Yeah, I don't think it's a bad thing. Like, I don't think passive intervention is bad. I think so. Passive intervention is very good in acute scenarios. So when I say passive intervention, that means anything that some therapist can do to you, like massage. I don't think it's a good thing, especially in the acute scenario. So, like, we have to consider your case as you have a chronic issue, but at times you have acute exacerbations. That's what you're in right now. Those acute exacerbations do very well with passive therapy, whether that's massage, physio, chiro, whatever. It's really about just preference and tissue preference and things like that on which one of those might be better. Mm-hmm. What happens is that will get you back sort of probably to close to your baseline normal chronic level issue.
Right.
The reality is, and this is it's a thing that I draw for people all the time. What happens with that chronic issue is that level is rising all the time. What you need to be doing in those times when you're not acutely exacerbated is the rehabilitation of your spine, right? So in order, like the fact that there's scoliosis is a curvature in the spine, which I'm sort of talking to educate anybody that's listening. That curvature in the spine, to some degree, all of us have maybe a few degrees, which is totally insignificant.
Right.
You don't get Harrington rods put in unless it's greater than 25 degrees, which is very significant. So you obviously had a very significant scoliosis when you were younger, and they put in the Harrington rods to stop its progression, straightening you out, which is good, but it does lead to degeneration. And more important than the degeneration, it leads to tissue weakness. And it's that tissue weakness which probably accounts for the greater amount of the pain that you feel chronic and probably in acute exacerbations. And it's not really the degenerative stuff. The degenerative stuff, when it's bad, will actually like impinge on nerves, and then people will describe like, my foot's numb all the time type of thing. That's when degeneration becomes more significant. So a lot of what you're feeling is probably related to the muscular integrity of the structures in your spine. And so I think the goal should be, to make this simple, in the acute scenario, doing a massage, I don't think there's anything wrong with that. I think on a long-term plan, though, you need to be incorporating proper rehab into your life every single day, because this is a management issue, under the guidance of a professional, and really working towards minimizing how often those acute exacerbations happen. Because the thing with these chronic issues and these constant acute exacerbations, and you might have already experienced this, is they tend to get a little bit worse each time. And then it will finally get to the point where it's like, okay, this is like bad. Like, this is really bad. It's not going away. What do I do in that scenario? But, your case is not the standard, simple low back pain type. No, low back pain is simple, but yours is more complicated because of the scoliosis. But I'm happy to assess you if you like. It sounds like, you're doing the right things right now. I don't think there's anything wrong with a massage in this moment. I think that where there's sort of a misconception is that people think then, like, I manage my chronic back pain by getting a massage once a month. Well, that might feel good, but it's not actually going to work towards actually doing anything overly significant.
So if I had like a large part of my spine or in that area obviously was fused.
Yeah.
So can you just briefly say when you mentioned the degenerative aspect, what can you specify in that, please?
Yeah. So the other thing about fusion is, we have to consider that the spine is not just one segment. It's a lot of segments with a lot of different joints.
Right.
From a mechanical perspective, with degrees of freedom and motion, what happens is, if you can just simply imagine, like, if we could imagine 3 simple joints together, let's say 4, and we fuse the 2 in the middle, right?
Yeah.
What ends up happening is the ones on either end have to move more. And that excessive motion, right? Because that's what leads to wear and tear. More motion will lead to more wear and tear. So typically with fusion surgeries, the area that's fused is never, like, that's sort of fixed. Like, that area is sort of fused. It can't really do much. The problem is what happens above and below. And, like, where was your spine fused? Where was the scoliosis? In what area?
Yeah, I can't say exactly in medical terms, so just kind of in the mid-range.
Right, okay, and so that makes perfect sense with what I'm saying. So mid-range, you get fusion, you get Harrington rods. What happens? Things above and below need to move a lot more. Well, what's directly below? The SI joints, those dimple areas that you're talking about. Like, that area now, your lumbar spine has to pick up so much more movement that is not being happening up higher, and that excessive degree of movement with things like shoveling snow, blah, 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 whatever it might be, that's when you're going to get set off. That'll be that instance where all of a sudden you do something mechanically, signals are sent to your brain says, the way it works is the degree of freedom within every joint is constantly being measured in our brains, right? Like, there are receptors that tell our joints what's going on, right? It's natural reflexes, and no different than if I pushed you and you started falling to the ground, you have a reflex to put your arms straight out, right, and stop yourself. Well, joints have similar mechanisms where when they get stretched too much and there's more mobility than is otherwise intended for that joint, receptors tell the brain, hey, stiffen the muscles, and stiffen those muscles so that you protect myself. That might protect the joint, but what it does is it creates pain. You now have spasm in your back happening, and that's sort of the faulty mechanism. That's why strengthening is so important, because you can then control the mobility, the amount of mobility, and not ever have it go into that excessive motion that then triggers the spasm.
Okay, I'll look for you guys here in March.
For sure.
That'll be under the PinPoint name?
Yes, sir.
Excellent.
Thanks, Richard.
Thanks, Richard. Appreciate that call. Good one. We'll take a short break here. You want to reach out in the meantime, 1-855-55 Dr. Lou. That's to get a hold of Dr. Lou at the clinic and move forward from there. info@pinpointhealth.ca. But for the remainder of the time we have here, do what Richard and everyone else has done. Get some answers off the hop at 416-870-6400. Pinpoint Health Show right here, Global News Radio. 11:52, last few minutes here. That means you got some time to squeeze in a call. 416-870-6400 is the way to go. We were just during the break, because Richard was talking about Harrington rods and scoliosis. We just Googled some pictures, and man,
to show you, like, Google that
like
stuff.
A question mark.
Yeah, no, scoliosis can be most of the time, like, I've heard a lot of people say, I've been told that I have a scoliosis, and then you look at them and there might be a slight curve, like 5 degrees. Like, don't worry about that stuff. Yeah. It's about when it gets really bad. Now, the other thing about scoliosis is it's worse when you're young, because as you continue to grow, it can progress. Typically, what we do if we see a young person with scoliosis is we'll monitor it up until 21 when skeletal maturity happens. After 21, it's usually not that big of a deal. You just want to make sure there's different levels. So, this is especially, I guess, for parents, if you're looking at your kids and they look like there might be something there, it's worth to get it checked out just to make sure, right? Because the progression is important. I mean, you can have traumatic scoliosis, like the example when we were talking about the compression fractures. Depending on the way it compresses in older age, you might create a curve then, but that's totally different. That's what we're talking about there. with the Harrington rods, and in young people we call idiopathic, which means we don't know why it happens. That's what idiopathic means. It's funny, I was saying, a teacher of mine used to say it means that the doctor's an idiot and the patient's pathetic, because neither of us know. So most of the time those things are idiopathic, but there are procedures. I mean, getting surgery, the Harrington rods, when you look at the pictures, it's a significant surgery.
Oh, yeah.
But if you need it, it's to some extent life-saving, right? When your spine's that bad.
Stupid question. Do they ever come out?
No.
They're in there for good.
Well, and then once you've put them in, bone starts to fuse around them. Right. And again, when you look at the picture, this is not like one simple thing. It's not like one mechanical piece. They're often a lot. They're there. You got hardware at that point.
You're stopping at every airport now.
Yeah,
right?
For sure.
Yeah, you ain't going through no scan from here on.
Yeah, for sure, 100%.
Again, 416-870-6400. You got a few minutes here to call in.
I think we have a call coming in. Before we get to that call, next week, special guest, we have Minister Christine Elliott, the Deputy Premier, and the Minister of Health and Long-Term Care of Ontario, on the show to talk about a lot of the new things that they're introducing. So I think it's a great show to listen to. So tune in next Saturday, 11 a.m. as usual, and Minister Elliott will be here with us.
Have you got any heads up of what's going on? Or
I think, why don't we save it?
Yeah.
Why don't we save it till next week?
We'll get to Carlos. Hey, Carlos, how are you?
Good morning, gentlemen. How are you guys?
Sure, we're good. What's going on?
That's great. A couple of things. My son is, like you were just mentioning, curved back.
Mm-hmm.
He's a little bit heavy.
Okay.
And when he sits, it seems his back is very curved, and he's been having lower back problems.
Okay, so there's, and that might be significant. When we're talking about a scoliosis, again over the radio, it's not like, where is the curve? Like when he sits, like his
on the top.
Yeah, that
top.
Yeah, it might not be a scoliosis. It might be a different form of curve, but nonetheless, it's probably important to look at, right? To at the very least get it assessed and determine, like, okay, what sort of can happen here. So I'm happy to see him if you like, and that's simple enough to look at him. How old's your son now?
He's 19.
19. So, like I was saying, he's close to skeletal maturity. So whatever is there probably won't progress much, but it might become significant enough to understand it so that he knows sort of like maybe the pain and those things. But I'm happy to take a look at it. Give us a call.
Because his weight has to do a part of that. That's correct?
Depends. Not necessarily.
Okay.
Yeah.
Another question I had, it was my knee, behind my knee. See, I'm in the landscaping gardening business.
Yep.
And behind the knee, right in the middle, behind the knee.
Yep.
It's not pain, but sometimes it's a little bit discomfort. Sometimes.
Yep. Same thing. That's the.
Is that cartilage or is that the?
I'd have to look at it. I have no idea. Yeah. That's not enough to diagnose.
Carlos, make an appointment for yourself, I guess, and your son for that matter. 1-855-55 Dr. Lou to do that.
People waited to the end, just like I started the show.
I know. Hey, Judy, how are you? I think we got time for you quickly. What's up?
Yes, just one quick question, Dr. Lou. I just wondered, how safe is it to have an MRI, mammogram, and bone density test if you're just past 76?
How safe is it?
How safe it is? I mean, I don't know enough about your medical history, so there's a lot of factors that go into that. There's no radiation with an MRI. It's a magnetic scan that moves, hydrogen elements and creates a picture. So that one has no radiation. The other stuff does probably. It's all about risk benefit, right? So I don't know enough about your past history to know whether that's something that's warranted for you or not. That's I think a discussion you should have with whoever your primary healthcare practitioner is.
Well, they're telling me go ahead and have it, but
then I think you have the answer.
Of the radiation.
I would, at 76, I would not worry about the radiation and imaging. Like there's the statistic, the research around that stuff shows that if there is an effect, it's usually 25 years after the image, and it only
is that right?
Yeah, and It only increases it by very little. So I think again, if you were 5, we'd consider a little bit more. 76, again, speak to your doctor about that.
Judy, appreciate that final call, and that'll wrap it for today. Again, next Saturday, reminder, Deputy Premier, Health Minister Christine Ellie going to be on the show with us, so stick around for that. That is it for the Pinpoint Health Show. Once again, we are out of here, and you want to reach out, 1-855-55-Dr. Lou, and info@pinpointhealth.ca.